National Center for PTSD at the VA Boston Healthcare System after receiving her doctorate in clinical psychology from the Georgia State University. She's involved with both the research and clinical components of the PTSD program, and her research interests fall under the umbrella of PTSD, moral injury, suicide, and include risk and resilience factors in veterans with a particular focus on female veterans. So, without further ado, we're very excited to have Dr. McGann back on, and we will pass over the presenter reins to her at this time.
Thank you so much for that lovely introduction, and it's so good to have so many of you joining us from so many diverse locations. Really, really pleased to be here today and look forward to the chat and the conversation. So today I'm going to be talking, let me just make sure the slides here work. Okay, let's see. There we go. Okay. So today I'm going to be starting to talk about a moral injury framework. We're going to define moral injury, and I'm going to present a clinical model. Then we're going to move on to talking about moral injury and suicide. Next, we'll talk about moral injury and survivor's guilt specifically. And I'm going to also be focusing today on self-forgiveness as a clinical manifestation of moral injury. We'll end with a case example, and I'm going to present briefly some treatment options for moral injury. So I wanted to start with defining moral injury, and this is specifically from our 2009 paper. So we define moral injury here as perpetrating, failing to prevent, bearing witness to, or learning about acts that transgress deeply held moral beliefs and expectations. Moral injury requires an act of transgression, so a crossing of a line that contradicts either personal or shared expectations about the rules or the codes of conduct, either during the event or at some point afterwards. So I want to also just take a moment to discuss a little bit about how PTSD and moral injury differ. So PTSD is really a DSM-5 diagnosis. There needs to be some kind of a traumatic exposure and the symptoms that occur that are listed below, so including re-experiencing symptoms, avoidance, emotional numbing, arousal, etc. While moral injury we really think of as a dimensional issue, and it's not a diagnosis. Moral injury really involves grappling with spirituality and your sense of self. Oftentimes we know that moral injury is happening when we learn about guilt, shame, or loss, in this case particularly during military service or at some point afterwards. And for moral injury, exposure is really not sufficient. And so many people experience potentially morally injurious events, and that's not enough to have moral injury. There has to be some kind of a perceived transgression. So the person has to feel like they actually crossed a line. Moral injury also involves some kind of functional impact, and often we see self-sabotaging behaviors, and I'm going to talk more about that in just a moment. For PTSD, the treatment is actually grounded in fear-based theories and exposure habituation to trauma, where with moral injury, really the focus is on spirituality, self-forgiveness, and making amends in particular. And so we're going to get more into treatment issues in just a little bit as well. So, okay. So here is a causal framework for moral injury, and I'm going to take you all through this. So as I mentioned, there often is a transgression that sets the stage for moral injury, and the person has to experience some kind of dissonance or moral conflict that occurs for moral injury to set the stage for moral injury. There also have to be some stable internal global attributions, so thoughts that the person might have: because I killed in war, I don't deserve to be happy, to have a family. That really sets the stage for the shame, the guilt, and anxiety that happen with moral injury. Today, in particular, I'm going to be talking about one type of guilt, which is survivor's guilt. That will then set the stage for a great sense of withdrawal. And so, really, the person feels like because they don't deserve to be happy, because they've done all these things, they really withdraw from their families, from society. And then there is a failure to self-forgive, which we'll also be focusing on today. And that's a really key piece to healing from moral injury is grappling with self-forgiveness and being able to start the process of self-forgiveness. And then when moral injury happens, we also see, unfortunately, a lot of self-harming behaviors, including suicidal ideation, suicide, and then also many self-handicapping behaviors, and so self-sabotaging behaviors. And so the person is often drinking, using drugs, but not only those things, also maybe not trying as hard as work or really withdrawing from the things that can make them successful in life. So I want to transition to talking about moral injury and suicide. And to do that, I want to talk about one particular individual, Noah Pierce, who grew up in Sparta, Minnesota, in a town of less than 1,000 people. Noah was someone who was very quiet and sensitive. His family described him that way, and he joined the army. He served multiple tours in Iraq. He also wrote letters home and to friends, and so we have a lot of knowledge about what happened to him and what he did. He also wrote poetry early on in his life, and while after he got back from war as well. While he was in Iraq, he did house-to-house raids. He also participated in quite a bit of killing, and he also had loss of people who were close to him. So there was a lot of despair while he was deployed, and also rage at the loss of people who were close to him. Noah, when he came back home, he did turn to alcohol to kind of numb some of the things that happened to him. And so I wanted to present a little bit about his life. So I cited here Gilbertson, 2008, has written quite a bit about Noah and his life. And if you're interested, I would recommend some of that reading. But I think this really says a lot here. Noah Pierce's headstone gives his date of death as July 26, 2007, though his family feels certain he died the night before, when at the age of 23, he took a handgun and shot himself in the head. No one is sure what pushed him to do it. It could have been the memory of the Iraqi child he crushed under his Bradley. It could have been the unarmed man he shot point blank in the forehead during house-to-house raid, or the friend he tried madly to gather into a plastic bag after he had been blown to bits by a roadside bomb, or, as the fragments of Noah's poetry might lead you to believe, it could have been the doctor he killed at checkpoint. So we do have a suicide note, and this is where I think it's very important to sort of put the pieces together of what happened. This is a suicide note that he wrote to his mother. He says, "Mom, I'm so sorry. My life has been hell since March 2003, when I was part of the Iraq invasion. I'm freeing myself from the desert once and for all. I'm not a good person. I've done bad things. I've taken lives. Now it's time to take mine." So it's really heartbreaking to read this note, and also we can see very directly the connection here between what he did, his attributions, that he's not a good person, that he's done bad things, and he's taken lives, he's turned the gun on other people, now he's turning the gun on himself. And sadly, this is not an unusual experience, that people who have moral injury, struggle with moral injury, really feel isolated and alone, and in the worst case scenario, do turn to suicide. So I want to talk a little bit more about suicide in this context. We know that veterans, a study that we did in 2012, we found that veterans who had higher killing experiences had twice the odds of suicidal ideation, compared to those with lower no killing experiences, even after you adjust for all the things that we know could also account for suicide. So, PTSD, depression, substance use disorders, other combat exposure. So, there really seems to be something about taking another life in war in particular, which is one type of injury that can set the stage for moral injury in particular. So I want to talk a little bit about a framework that might help us understand why these things are all connected. And that's the interpersonal psychological theory of suicide by Joyner. And there are three components that are important. I want to just quickly put up a figure here that shows us that suicidal desire is made up of thwarted belongingness and perceived burdensomeness. I'm going to talk about those in detail. And then in addition to the desire, you have to have the acquired capability for suicide, which I'll also define in a moment. So the idea behind thwarted belongingness is that you're isolated, you feel like you're no longer part of a tight group like you may have been in the military, you don't feel like you fit into civilian life, and so that really creates a sense of intense isolation. Then perceived burdensomeness is this idea that you're a dead weight, that you're not contributing, you're taking up space. And this is really associated with a lot of self hatred. And finally, there's the acquired capability for suicide. So the idea here is that when someone has been exposed to a lot of pain, a lot of death, and a lot of killing, it's not easy, it's not hard to understand how they would then turn the gun on themselves as well. So those three pieces have to really act together in order for a suicide to happen. So I'm going to review, there haven't been a lot of studies on moral injury and suicide, but I'm going to review with you the ones that exist. And I think they really help us understand not only the connection between moral injury and suicide, but also offer some clues for intervention for how we can help, which I think is critical. So the first study that I'm going to review is by Craig Bryan and his colleagues, and they studied 930 National Guard personnel. Among active duty personnel, they found that moral injury was associated with more severe suicidal ideation and suicidal behavior. And they really found that PTSD and moral injury, as we discussed before, represent separate constructs with unique signs and symptoms. However, having both PTSD and moral injury increase the risk for suicidal thoughts and behaviors. And it really differentiated between those who just had thoughts as well as those who attempted suicide. So if you had both PTSD and moral injury, you were more likely to have attempted suicide. The next study was done with Israeli veterans, and they found that moral injurious experiences were significantly related to both ideation and behavior. Both self-related moral injury, so if you did something yourself and felt like you crossed a line, as well as betrayal-based moral injury. These were both significantly associated with a sense of entrapment. And entrapment is defined specifically as a perception of the individual circumstances being uncontrollable, unremitting, and inescapable. So the sense that you're really trapped and can't get out of the current situation that you're in, you can see how that would breed a sense of hopelessness. So they found that the relationship between moral injury and suicidal ideation was mediated by both entrapment and depression. So those were really critical components. And so I think that this really has important implications for treatment. So if we are thinking about treatment, we not only have to target moral injury, but also the underlying depression and sense of being trapped as well. The next study was done with 131 U.S. Army and Iraq and Afghanistan veterans. And what they found was that the relationship between moral injury and suicide was really connected through meaning making. And so, more specifically, the greater the ability of the person to be able to make meaning out of the moral injury experience, the less intense the suicide was. And so, this really points a finger at needing to help people make meaning out of what happened to them and really understand. So we can't avoid what happened to them, but we really have to delve into it and understand and help the individual make some meaning, and help process the moral injury in a safe environment. There is another important study that found that among wounded combat veterans, um, really suicidality decreased with greater mindfulness and social connectedness. And so there again are implications for treatment here that if we increase mindfulness components that are palatable and tailored to individual preferences. This can really help with suicidal ideation. And also that, it's important for us to remember that social connection can occur in many shapes and sizes. And particularly if we can think about incorporating both mindfulness and social connection, we can really reduce the risk of suicide in those with moral injury. I'm seeing that audio is not working for some people, and I just want to make sure. Can you organizers just please chime in and make sure that that they are able to hear me? Okay. Okay. Perfect. Thank you so much. I was just worried that somehow. Great. Okay. Thank you to verifying that. I just didn't want to keep going if there was an issue with the audio. Okay. Wonderful. So we were just at talking about how it's very important um, to think about both mindfulness and social connectedness, and when we think about reducing suicidality in individuals with moral injury. Okay. So, one important area that has not been researched as much is survivor's guilt, and I want to really talk about how survival guilt in moral injury is different than what we traditionally think of in PTSD. So, while in PTSD, survivor guilt is about the fellow service members who did not get to survive. With moral injury, it's about those who the veteran harmed or killed in war, and that the veteran still survived. So the idea here is the veteran is thinking, how did I get to survive when I killed others? So it's really coupled with a sense of having to often pay a lifelong debt for survival in the midst of killing others. And this sense of debt, can really manifest in self sabotaging behaviors, self harming behaviors. One veteran specifically described it as taking away someone else's soul and feared that he or his family would be harmed in return. So it's this idea that the gravity of what happened was so profound that really there was a lot of guilt for surviving himself when he took away someone else's soul. And then what often comes hand in hand with that is this fear that something is going to happen to the veteran or their family. And so it's a multi pronged sort of process that happens that is really starts with the survivor's guilt. So in addition to the guilt, there's a notion of karmic retribution that's common with survivor guilt. And so the idea that the scales somehow need to be rebalanced. So you took a life and something needs to happen to you in order for the scales to be rebalanced. So righting the wrong that has been done. And this really emerges as thoughts about not deserving to be happy, not deserving to have a family, when someone else was deprived of these core things. So we also see suicidal thoughts and behaviors with survivor's guilt. If you remember back to um, the model that I showed you in the beginning, the guilt is really tied to some of the further distal outcomes of suicidal thoughts or behavior. The person will also sometimes actively sabotage any opportunity to be happy or to be successful at work, at home. And what we often see is that this often emerges during major life milestones. So, for example, the birth of a child, the death of a family member, marriage. So it's this idea that the person doesn't deserve these things in life because they took away someone else's life. So the underlying thought is I get to experience life when the person I harmed or killed did not. Um, and survivor guilt for moral injury is really linked to the inability to self forgive, which I'm going to talk about next. So I like this quotation about self-forgiveness in the context of moral injury. I think it's important. The person who habitually works towards a state of genuine self-forgiveness exhibits an important virtue. She recognizes her own intrinsic worth, which she retains in spite of her wrongdoing. And so I think what happens oftentimes with individuals with moral injury is they become their wrongdoing. So here, really, this quotation is talking about that there is a sense of self-worth despite what happened. And oftentimes with moral injury, those two things really get intertwined. And that fosters a deep sense of personal shame. And it also sets the stage for suicide and suicidal thoughts as well. So I'm going to talk about the importance of reconciling what you did with who you are and all its complexity. So we're going to be kind of talking about throughout integrating what you did with who you are, and those things sometimes can be hard to reconcile. So, self forgiveness is a process in which a person first has to accept responsibility for having harmed another. That's the first step. Expresses remorse while reducing shame. So, there has to be some kind of remorse that is expressed openly. And then the person engages in restoration through reparative behaviors and a recommitment to their values. Often the values have always been there, but it's just kind of bringing them out into the open. And thus the person achieves a renewal of self-respect, self-compassion, and self-acceptance. And so we're going to come back to all of this in just a moment, particularly the self-compassion that has to happen to self set the stage. And as we talked about before, forgiveness is really a key component of the moral injury model.
Dr. McGann, we did have a couple of comments and questions come through.
Perfect.
Um,
Okay,
so one of the
great.
questions is, are there any means tested screening tools for moral injury?
Yes, there actually have been a couple developed now. So there's the moral injury event scale by Bill Nash that is something that I use in my work by Bill Nash and his colleagues. There are also a number of other ones that I encourage people to look at. Maybe what I can do is send some of those measures that people can look at, or the articles associated with those measures. So there are about three that I'm thinking of, and there's constantly ones in development, and so I can follow up with that so that everyone has a chance to kind of look at those in greater depth.
Okay, perfect. And we just had a couple of comments.
Yes.
One individual said, so much of the injury seems tied to not being a good or perfect person. And I wonder if part of the meaning making lies and recognizing the patient's caring capacity, the fact that they do care about being good, is an indicator of who they are as a person. To appreciate that is important.
Absolutely. I think that that's a critical point. So I think that people who have moral injury um, are reflecting on what they did because they are so invested in their morals and their values and wanting to be a good person. Um, and so I think that that's key, and that's actually a big piece of what we work with people who we see for treatment is recognizing where this conflict is coming from. And often when you unpack that, you really get to the sense that it's because they have such a strong moral compass and they're really thinking about and processing what they did and wanting to reconcile that. And so we take a look very deeply at who they are as a person and what those core morals and values are, and help them integrate what happened with some of that sense of their already existing morals and values and wanting to be a good person. So that is absolutely true.
And finally, just the last comment that's come through was from Lynn, and they mentioned we see survival guilt come through with the question, "Why did God save me when my troops were killed?" It seems different. If I ask them about survivor's guilt, they tell me it is deeper than that.
Mm, yes. Well, and survivor's guilt is very deep. And I think one thing that I'd like to see happening in the next few years is a lot more qualitative work. So, interviewing people who have moral injury about why they have survival guilt. And so, I think you're absolutely right that it's tied to spirituality, but it's tied to so many other things too. And it's really at the core. I think there's a lot of existential struggle that happens in that survival guilt. And so I think it's a very under researched area, and I'd like to see a lot more so we can better understand it because it is very complex. Great, and please feel free to interrupt me. I'm sort of trying to keep a little bit of an eye on the chat, but don't hesitate to jump in if there are questions that come in that would be helpful for me to answer. That's great. I'm glad you did that. Good. So why forgiveness? So I think that there's been a recent systemic review and meta-analysis that found that forgiveness interventions were really affecting in reducing a number of mental health and functional outcomes. So depression, anger and hostility, stress and distress, and they're also very effective in promoting positive affect. So overall, forgiveness can be effective in promoting different dimensions of mental health and well-being. So that's why we kind of also focus on forgiveness and self-forgiveness. So I'm going to delve a little bit more into moral injury and self-forgiveness. Um, and self-forgiveness, as the question kind of highlighted, is really a process involving moral engagement. Authentic self forgiveness is quite a painful process that can involve self challenge, cognitive processing, spiritual engagement, and shifting perspective. So it's a very dynamic process. So you have to come into this. If you want to self forgive, you have to really be able to challenge some of those static thoughts that you may have had that are guiding your thinking about yourself and your forgiveness, and really be able to challenge that. So it's a deliberate process involving accountability, reconciliation, self acceptance through human connectedness and commitment to change. And I think that this really involves not only doing therapy, but it involves engaging spiritual communities, other communities that can help the individual. And so clearly, our chaplains and our spiritual leaders are, have always played a very large role with this. And so we have to build those bridges. And that's really the only way that this is going to be successful. It's therapy is one small piece of a much larger picture. So forgiveness often starts with guilt that can act as a catalyst. So whether that's survivor's guilt or a different type of guilt that an individual feels, so that's the catalyst of change. But the danger is that it can flourish into intense self-condemnation. And so um, we wrote a paper in 2018. Natalie Purcell was the lead author on that really kind of explores self-forgiveness. And I encourage those of you who are interested, I'm happy to kind of pass that article along as well. But I think the key here is that guilt really can act as a catalyst of change. And some people kind of spin into that self-condemnation cycle, but oftentimes they will come back and be really that guilt is sort of what starts that cycle. And then forgiveness continues with a desire for change. So that also has to be there. Ideas about self-forgiveness come from culture, from family, from the military, from spiritual communities. And so it's very important for each individual to understand where their sense of self-forgiveness comes from. And that's something that we do in the treatment that I'm going to talk about. So there can be so many barriers to self-forgiveness, but what we hear quite a bit is to forgive is to forget. The feeling that the act was too horrible to ever be forgiven, that only higher powers can forgive, only victims can forgive, and that self forgiveness is just not deserved. So I think here, the articulation of barriers to self-forgiveness also empowers the veteran to begin analyzing and disentangling destructive beliefs about the self, finding small openings that illuminate a potential pathway to the restoration of moral identity and self-regard, a pathway that must ultimately honor the veteran's most deeply held convictions and values. So again, what we're looking for here to start the process is just a small opening, where we can see a pathway to all of these things being restored. And often it really is just a small window. How do we get in there and begin to kind of have these conversations? So, not only does the path to self forgiveness include accepting responsibility, but also building self compassion, making amends. We'll talk about this in a lot more detail in just a moment, and reconstructing an intact moral identity. And that really is the integrating what you did with who you are. So, kind of putting those pieces together, which is oftentimes where a person might get stuck, and monitoring improvements in functioning can really serve as a barometer for the process of self-forgiveness. So I think that that's a really important piece here, that we always want to be looking to the functioning as a barometer. So has relationship and work education functioning improved? Have they re-engaged? Has the individual re-engaged with their spirituality? So this is one veteran who participated in our program. I think it's very important to kind of have some of those voices come alive. So addressing self-forgiveness can help because it's freedom from being captive. It's not that I'm guilt-free or shame-free. It's just that I'm not packing around all that load, that weight. How do you describe opening a door to a new life? So again, it's this idea that you don't make the memory go away. You're still going to have some guilt, you're still going to have some shame, but it's really that you're living your life in a different way, and that you're engaging with those thoughts and those memories in a different way. So how do we treat moral injury and cultivate self-forgiveness? There are many PTSD treatments that are around, and there's evidence-based psychotherapies, prolonged exposure, cognitive processing therapy. Those are all good starting points. But what we have found is that you need to go further when someone is often struggling with moral injury, and specifically talk about issues of spirituality and self-forgiveness. And um, so I think I'm going to talk a little bit about one treatment option, and then at the end I'll talk about a number of other ones. So we have worked with the impact of killing treatment, or IOK, and these are individual-based sessions. They're 10 sessions lasting 60 to 90 minutes. And these are sessions where we really delve into the morally injurious event. How is IOK different? So rather than challenging thoughts, we also hand in hand work on acceptance. So we have to accept that what happened, the person may have crossed a line, they may have done something that goes against their morals and values, and so we have to balance those things. We addressed very directly spiritual and moral concerns. Very directly, we address self-forgiveness. We do tailored letter writing, which I'll talk about. We also foster connection with others and focus on amends. Um, Many people who struggle with moral injury have also struggled with addiction, and so that's a familiar language to them. And we see treatment as a catalyst rather than a resolution. So we see the process of self-forgiving as an ongoing process rather than something that's going to be fully resolved. So I see a question here about do we incorporate chaplains? Absolutely. What we do is we make a tailored plan with individuals, and oftentimes that involves re-engaging with spiritual communities. Oftentimes that involves working directly with chaplains. The person will go see a chaplain, and that's going to be a core part of their healing and their treatment. We're very lucky at RVA to have wonderful chaplains who have been very, very supportive of collaboration, working together.
We had a few
So
more questions come through, Dr. McGinn.
yes, please.
Okay. Um, One was from Lynn. Do you differentiate moral injury from spiritual injury, and do you believe the two go hand in hand?
Absolutely. I think that that those two go very closely hand in hand, and we actually conceptualize that as a part of what. And when I talk about the case discussion, I'll also talk about this, that this is spirituality is absolutely a component of what we work on, and looking at the person's spirituality, and specifically how that's tied to self-forgiveness as well. So we really see those as very important and very related.
And Christy asked the question, is cognitive processing therapy the best way to address moral injury or EMDR?
From my experience, I think that cognitive processing therapy can be a very good way to set the stage for having some of these discussions. And so of course, people have different opinions about this, but I think that with cognitive processing therapy, you're really able to kind of get in there deeply. But as I mentioned before, I think that with some people, that is going to help solve the problem or start to solve the problem, but sometimes they need more with individuals, especially if they're struggling with issues of self-forgiveness, that 12 sessions of CPT is not enough to treat. So I think that that's so I would monitor that and really make sure that if they need something more, you're looking out for maybe one of the treatments that I'm going to talk about, either IOK or ones that I'll talk about at the end of the session.
And Thomas, who's watching from our YouTube channel, asked if an individual does not have a sense of spirituality, will that become a complicating factor for recovery?
That's a great question too. So we really have seen individuals who, I think the thing that's important to say here is that we look at spirituality broadly. And so even people who feel like they don't have a sense of spirituality, oftentimes they can do things that to them feel spiritual, or to them feel like they have created their own spirituality. But so spirituality doesn't have to equal an organized religion or religiosity. And so I think that that's what we work with the individual to do, to think about what does their spirituality look like. But no, I don't think that that's a barrier. It's just one of many components that we talk about.
And we had several more questions come through. Are you okay with going ahead and
Yeah,
answering those?
yeah,
Okay.
let's do it.
All right. So Margaret mentioned, do you find it helpful to discern between shame and guilt? I am a bad person. I did a bad thing. I'm not sure how well people will respond to lexical, almost neurolinguist programming type view.
Yeah, so I think that we do try to distinguish between, like, and we try to help people sort of pull those things apart. So really guilt, looking at like what you did and the feelings that are related to what you did, versus really looking at who you are as a person. And so I think it gives people the language, as you were kind of pointing out, to talk about those things differently, and notice that both of these things may be happening, and to also notice how they overlap too. And so I think it can be very helpful for people to just break that apart a little bit, because then it doesn't feel so overwhelming, just this kind of deep dark mass, but that there's different components that are working together, that we need to look at, both separately and together.
And Kathy asked, is it imperative you separate guilt and shame? You cannot heal until you can get to, oh, sorry, I think we just may have answered that one. Versus,
Okay.
I am a bad person. Sergio asked, does treatment include meditation or yoga to engage body and mind?
That's a great question. And so, what we do with the individual in IOK in particular, and I think that different treatments handle this differently, but most of the treatments for moral injury do incorporate some mindfulness, some sense of what the individual is most drawn to. So, for some veterans that I've worked on, their amends plan includes doing yoga, meditation, etc. So we kind of work with them. For some people, that doesn't feel as you know, like they're drawn as much by that, but it really kind of, we work with the individual. We do for IOK, we teach them breathing, and we integrate specifically exercises that cultivate self-compassion. And so I think that that is something that is a very active piece of that treatment. And then beyond the breathing and beyond the cultivating the self-compassion, um, in the treatment, we also, through their amends plan, integrate other ways that can be helpful.
We have two more questions we're going to get to, and then we'll keep on going.
Okay.
Um, Jade asked the question, how do discussions get into the deep regions of the brain when the prefrontals are on versus the amygdala being activated?
Yeah, well, what I would love to do is some research about, some fMRI to really look at those questions, because I think we can only hypothesize at this point. But I think the amygdala is really key. And so you can do this work and be cut off from your emotions and not really get the full benefit. So I think it's actually critical. And in IOK, a lot of the things that we do are really to activate the amygdala, to feel the feelings, and also to take different perspectives as well, that are emotionally laden. And so I think those things absolutely have to work together for healing to occur. And I'd love to be able to kind of at some point down the line look at that kind of in a more functional way as well, in terms of looking at the regions of the brain.
And then finally, if you can maybe speak on the perspective of family caregivers, would you define the guilt that caregivers feel if their family member commits suicide or they have to make a medical decision, such as taking them off life support as moral injury?
Yeah, yeah, that's a great question. I think one of the things that I've been thinking a lot about, with my team is, um, we've done a lot of work with moral injury and veterans, and the field has been really focused in that area. There isn't as much research on, and there should be, on first responders, on caregivers, on nurses and doctors who have um, to sort of help families and caregivers um, make these decisions about life support, et cetera. So I think that that is, an area where we need a lot more work to understand that. I think definitely been thinking a lot about moral injury in the context of our current COVID pandemic. And so I think that caregivers in particular, um, through suicides experience, and we saw this, if you read a lot of the work that I presented earlier on, the Noah Pierce's family really suffered tremendously, and we see that in our patients as well, unfortunately, who we lose. Their caregivers are left to kind of carry that weight, which is a very, very heavy weight. And um, so I think there can be very complex reactions, including, especially if they feel like they didn't do enough, or if they could have done more. There's just these feelings that can really crop up, and engender moral injury as well. So I think that these are all areas that we could really explore further in the future. Okay, good. So should we move on? I think this is such great questions and such great conversations. Um, so addressing self-forgiveness in IOK, how do we do that in IOK? And this is just one of many examples. We raise the topic of self-forgiveness very directly. We invite discussions of personal meaning, cultural relevance, and spiritual significance of forgiveness, because with each individual, what's so incredible is that the ways in which they interpret self-forgiveness and the impact that that's had on their lives is so diverse. And so even if you think about different spiritual backgrounds or Native American veterans that we've worked with, the cultural relevance is very different. So we necessarily have to work in that context, and it's so important to do so. We directly explore self-forgiveness barriers and facilitators, and we want to create a personalized, patient-driven, action-oriented forgiveness plan. And so this is where the forgiveness plan is different than the amends plan, which I'll talk about in a moment. But this is a plan where we really sit down with them and outline the steps to their own self forgiveness. And this is really designed to be used as a springboard, and we keep adding to it as we learn more and think more about the treatment. So there's exercises to define self forgiveness, to delineate the cultural beliefs about forgiveness, and to conceptualize how they've applied forgiveness to themselves and others. And so um, what we do is we also work up to having them write forgiveness letters that facilitate perspective taking, and as was brought up before, also that emotional connection. And so one letter we have them write is to the person that they killed or the person that they harmed during war. We also have them write a letter to their younger selves oftentimes, and then to facilitate perspective taking with sort of who they are now and their younger selves, we also have them write a letter from from the perspective of someone who might be a compassionate person who is outside of their current. So basically, the third letter that we have them do is to shift perspective and have them write the letter from the viewpoint of a compassionate person to kind of get out of that mindset of being stuck and in the self-loathing. So that's important. And then we develop with them an amends plan and develop with them a plan identifying specific action that they can take to reaffirm their violated values and to reconnect with others. So I'm going to give some examples of that in just a moment, but this is a combat veteran, again, in his own words. I had to learn to love myself. At one time, I couldn't love myself. I had to forgive myself. So really kind of showing us how tied these things are. If you don't have that self-compassion, it's not going to be able to set the stage for self-forgiveness. So here is the IOK treatment overview. I'm not going to have time to go over this in detail, but we've written a few articles that really can help with fleshing out some of these details. I just wanted to really point out that in sessions 7 and 8, we do a lot here that I described about self-forgiveness and forgiveness. All of the pieces that I just talked about in the previous slide are done in those sessions. And then in the session after that, we really talk about the future and taking the next steps with making amends and connecting to others. So I wanted to give examples of relevant cognitions that people have that are related to some of the areas that I talked about. So an example of a thought with survival guilt is I feel guilty for surviving when I killed others. With suicide, I don't deserve to live because I took someone else's life. Self-blame, I deserve to suffer for killing. Self-forgiveness, I don't deserve to be forgiven after killing. Moral violation, no good person would have done what I did. And spiritual disillusionment, I don't deserve to practice my faith because I killed. So I think that these are just kind of cognitions to watch out for and kind of connect them back. And then the behavioral manifestations that we see are really self-harming behaviors, alcohol or drug use, self-sabotaging behaviors, withdrawal. So these are all things that we can see behaviorally that happen. I'm going to briefly try to flesh out a little bit of the homework assignments that we assign. So the forgiveness plan, we talked about kind of listing out the pros and cons of self-forgiveness so we can look at those in detail, talk about the letters. And with the amends plan, I wanted to sort of point out that this was really an action plan that honors the veterans' values. So we talked about, for some veterans, that's going to be time with family, time with other veterans, engaging in self-care. That can include meditation, yoga, being out in nature, taking trips, activities, or hobbies. And for some, it's going to be re-engaging in a spiritual practice, whether that be kind of reconnected with communities of faith or doing their own spiritual practice that they've come to. So very, very quickly, before we go into the case presentation, I'm going to just show you, these are just some ratings that veterans who participated in IOK made. And I particularly want to highlight that um, how important it is. So I find that I have more compassion for myself. I think that's a key piece to really being able to delve into moral injury and an outcome of grappling with some of these things. So more compassion for yourself, connecting with your spirituality, being more accepting of yourself. People feel like they're more forgiving after they do a treatment on moral injury. They recognize that the process of healing is ongoing, and that they're more accepting of different aspects of themselves. So that's really what we're going for, to recognize that here there are different pieces of myself, and I'm really working hard on integrating those so that I don't have to feel like what I did is separate from who I am, and those things can be viewed together. So I'm going to move on to kind of presenting um, a veteran that we worked with. Some of the details have been changed to protect this person's identity, but I think at the core you'll understand what an important struggle this person went through. This is an Iraq War veteran, African American, in his 40s. He served 3 tours in Iraq as an infantryman. He had childhood trauma, specifically physical abuse growing up. He had a strong religious upbringing, and he described when he came to us that he had lost his faith and was not able to engage in some of the things that were helpful to him spiritually. He came to us actually after he was hospitalized following a suicide attempt, where he felt like his life wasn't worth living anymore. He had a lot of alcohol use after his deployments to cope, and he had been under the influence when he tried to take his own life. His trauma was that he killed a child in Iraq who he thought was armed. Then he returned home to his own child and had a very, very difficult time. He had profound survivor's guilt. He felt like, why should he deserve to be happy when he killed a child? Why should he deserve to have his own child and watch that child grow up? He thought a lot about the parents of the child that he killed, and really had horrible symptoms and horrible nightmares and horrible self-sabotaging behavior. He had a fear of karmic retribution, and really felt like something was going to happen to him to right the wrong that he had done. He was worried that something was going to happen to him and his family in particular. He felt like he just could not be forgiven, and he was very worried what would happen if others found out what had happened in war. So he really coped with that by isolating and drinking and disengaging from the world. So when after he healed and was stabilized, he tried to do an evidence-based psychotherapy, prolonged exposure, and then this was, he actually did that before he was hospitalized, and then after he was hospitalized, we and was stabilized, he engaged in the impact of killing treatment. And what after he went through this program with us, he recognized that his suicidal thoughts and his attempt was really a result of wanting to balance the scale and of his survival guilt. So he was able to make that connection. He recognized that he wanted to increase his functioning and his connection with his family, but he felt that he was undeserving. So he was really struggling with trying to reconcile who he was morally with killing a child. And so this was something that we worked with him a lot to be able to better understand. He wanted to know, what does this mean about him that he did this in war? And so we really looked at the meaning. So kind of thinking back to some of the slides that we were talking about before, some of the meaning of what it meant about him. We explored the pros and the cons of forgiveness, and he wrote multiple letters, including to the child that he killed. He recognized that his own child and family were suffering, and part of his forgiveness plan was to continue to write the letters. So he wrote the letter to the child that he killed, to the child's family, and he realized that the next one that he needed to write was a forgiveness letter to his own son. And he wasn't necessarily going to share that with his son, but he knew that he needed to kind of process some of those feelings. He recognized that he needed to reconnect with his spiritual community. And luckily and very thankfully, he was embraced upon his return. He just sort of shared with them that there were things in war that he did that kept him away, not necessarily the details, but that was very important to his healing. Um, and he recognized that he needed to be more present for his family rather than haunted by his survival guilt. He was able to articulate that healing was an ongoing process, and he greatly was able to increase his functioning and reduce his suicidality after he was able to make these connections. So that was very important in his healing. So I know that we have about a minute left, and so this is my last slide, and I wanted to just highlight there are really some excellent treatments that are out there for moral injury that are in various stages of research. Adaptive disclosure is a treatment that's out there. That is 12 sessions. It's an individual therapy similar to IOK. That there's also Building Spiritual Strength by Irene Harris, which is 8 group sessions, 8 weeks of group session. There's ACT Moral Injury. That's also 12 sessions of group. There's Trauma Informed Guilt Reduction Therapy by Sonia Norman, which is 4 to 7 individual group sessions. And there's also a moral injury group by Antal and Yeomans. That's a 12-week group that really engages the community as well and has veterans come to group, and the community also joins for part of that for some rituals. So I wanted to just let people know that those were out there. There's so much information and never enough time to present it, but these are all things that you can look into. And finally, I just want to say thank you. It kind of takes a village to do this work. And finally, if put up here, if there's any questions or comments, please feel free to email me. And also, I know that that we'll be able to kind of field questions after this as well. So I'm happy to do that through the organizers of the conference as well. So thank you so much. This has been such a pleasure and such good questions and discussions. And I look forward to engaging with you guys with your questions after we're done with this as well. So thanks for everyone's time and for joining us today.
Thanks, Dr. McGann, and thanks for everyone for attending today. There are a few questions that we were unable to get to, but I have made note of them, and we will make sure that we post those answers on the event page, the link that we've been posting throughout today's session. For those of you that are interested in receiving CE credit or a general certificate of completion for training hours for your associations, there will be, and if you're noticing on the slide that's up right now, a evaluation link that's going to be purple that says continue education that's going to be posted on the event website as soon as we get off today. And you'll go to that purple link. Thank you, Coral, for posting that. Um, You'll be able to go through a survey evaluation, and once you complete the survey evaluation, you will then be prompted to select whatever CE credit you are looking for, whether it's social work, LPC, LMFT, case manager, board certified patient advocates, certified family life educators, or the option of just a very general certificate of completion for training hours. We do have all of these 5 options. Now, please note, if you are interested in social work, LPC, or LMFT CE credit, you will have to complete a post test after your survey. That is the only accrediting association that requires a post test. So please note, I have posted my email address in the chat pod. It's also on the PowerPoint slides on this particular slide. If you have any questions, about CE information or receiving your certificate, that certificate's going to be automatically generated to your emails. Catherine, sorry, there are no psychology CEUs for this particular webinar today. We do offer just general certificates of completion, though. If you have any questions, feel free to send me an email and I will help you through this process and make sure that we get your certificate sent to you. Also, if you were unable to get connected, or if you know of some folks in your offices that were having some technical issues with today's presentation, a recording of this presentation will be posted on the event page. So you are still able to send that link out to your colleagues, or you're able to continue watching this presentation again or share this information, and you are able to receive CEU credits after today's webinar. Our CEUs are good for a year, so please come back to our event page website where all this information is, and you can find that there. Also, for those of you that are still on, get connected with us next month. Our next month's webinar will be focusing on working with difficult clients. And so that'll be Wednesday, May 20th at 11 a.m. Eastern Time. That webinar information is on the PowerPoint slides as well. I'll also post it in the chat pod to join us as well. And then for those of you, we don't have it posted on our PowerPoint slides, but I know many of us are teleworking at the moment. And a lot of our teleworking, we're having to keep up with our professional development training. So please note, all of our MFLN offerings are free offerings. Our CEUs are free to you. So please get connected with us. I posted a link into our chat pod that takes you to several online learning courses where you're able to receive free CEU information. I know an individual posted in the chat pod about post-traumatic growth. We have a training specific to post-traumatic growth. Um, Please use that link, take advantage of our CEU offerings. And if you have any questions, please let me know. And again, thank you all so much for joining us today. And thank you, Dr. McGann, for another great presentation and lots of information. So we really appreciate your expertise in this area.
Thank you so much for having me.
We'll stay on for a few minutes to gather any final questions that we may have missed that will get answered on our event page, and then we'll stay on for last minute links for you to gather as well. I'm sorry, Sandra, we are not providing psychologist CEU credits for this webinar. We only are providing social work, case manager, board certified patient advocates, certified family life educators, and general certificates of completion.